All right, it's 12:30, so we'll go ahead and get started. Welcome. My name is Sarah Sims. I'm the Assistant Director for Professional Development here at the Brown School at Washington University in St. Louis. Thank you so much for joining us for today's Open Classroom. Open Classroom is the Brown School's virtual and free professional development series. Beyond Open Classroom, we have what feels like a million other CEU workshop opportunities. So if you are looking to deepen your learning, earn continuing education units, anything like that, I invite you to visit our site, which is listed on the screen, and I'll also put it in the chat to check out what we have. We have year-round opportunities on almost a weekly basis. Before we get started with our presentation today, just a couple of housekeeping items. First, it's a Zoom webinar, which just means that we can't see or hear you. But as many of you have already done, you are able to use the chat. So we would love to hear from you. You can introduce yourself, but especially we would love to have your questions and comments for the presentation today. You can leave questions at any time. And then at the end, we will field some of those questions to our presenter. The other housekeeping item is that we are recording this session, and the recording will be posted on our website and YouTube channel sometime tomorrow. So if you want to share this information and the presentation with somebody, a colleague, you will be able to do that, as well as access over 200 past recordings. So now I'm going to hand it over to my colleague in admissions, Sarah Lucan, who's the Associate Director for Admissions and Recruitment at the Brown School, and she's going to introduce the program and speaker for today.
Thanks, Sarah, and thank you all so much for being here today. I'm thrilled to welcome everyone to the 5th installment of our Curriculum Showcase series on Open Classroom. Big thank you to Sarah and the Brown School Professional Development team for partnering with admissions to bring this great series to our prospective students and the community. I saw a couple of you introduce yourselves as recently admitted students, so congratulations to you, and we're so glad that you're here. We hope that what you gain from this open classroom is a little more knowledge about the topic being discussed, and for prospective students, a sense of what you can expect in the classroom with the renowned faculty members who are being featured in this series. Today's session specifically offers a sample of the type of issues addressed by our public health related curriculum, particularly the health policy analysis concentration in the Master of Public Health program. I am pleased to introduce today's speaker. Timothy McBride is the Bernard Becker Professor at the Brown School and an influential health policy analyst and leading health economist, shaping the national agenda in health insurance, health reform, rural health care, Medicare and Medicaid policy, health economics, and access to health care. In addition to several dozen scholarly publications, he produced the book Transdisciplinary Public Health, Education, Research, and Practice, co-edited with Deborah Hare-Joshu, as well as a collection of reports, white papers, and other policy products that have been important impact on the national policy debate. Professor McBride serves as a member of several national committees and boards, including the Midwest Council for the Institute for Clinical and Economic Review, ICER, the St. Louis City Board of Health, and the St. Louis County Justice Services Board. He is past chair of the state of Missouri's Mo Health Net Oversight Committee, which advises the Medicaid program in our state. So with that, I will turn it over to Professor McBride. Thank you.
Thanks so much, Sarah and Sarah. I will share my screen here, and I gotta get everything. Oh. Sorry, I wasn't on the first slide. Now I'm in the right place, right? So it's really a pleasure to talk with you today about a subject that I've been working on for a long period of time, and I really pleased to talk to prospective students from, it looked like, all over the world, perhaps, and all over the U.S. And potentially other places. And as Sarah mentioned, I'm a professor in the MPH program and teach a lot of the health policy curriculum. And these are some of the things we talk about. And I know there might be some community members and including some of my friends. So glad to see you again. So some of the things I want to talk about today are funded, and I want to acknowledge our funder. My funder on a lot of this work is the Missouri Foundation for Health. And they've been funding a lot of our work on the Medicaid expansion. So here's a few things I want to talk about today. And I'll try to leave time for questions at the end. First, how we got here. History of the Medicaid policy in Missouri, which is an interesting and I think fairly unique path. And then we led to the Medicaid expansion vote in 2020. The current status of the expansion, including some concerns over applications and delays, and what's called the unwinding of Medicaid. That term's a little bit inside baseball, but it relates to a lot of people were added to the Medicaid rolls during the pandemic. In Missouri, the rolls, as you can see, grew by over 600,000. In the nation, it grew by over 20 million. And after June of last year, they started reviewing those applications. And so far, we've 12 million people have lost their Medicaid coverage. So we'll talk about all that and the implications of at the end. So as I mentioned, the current status of Medicaid is that expansion was in 2021 after the passage of the Medicaid ballot initiative. The legislature refused to fund expansion, and the state had filed the things to require the state plan amendment. But after the legislature voted funding down, they basically said they weren't going to fund it. And the governor then withdrew the state plan amendment, and then a series of lawsuits were filed within the state, and the lower court actually said the amendment was unconstitutional. That was appealed directly to the Supreme Court, and then in 2021, the expansion began. The current status, just to jump ahead, just to give you a number, and I will take you through this path, was that the state began expending, taking applications in July of 2021 and enrolling people mostly in October 2021. And as of last month, or last time they released the numbers, there were 330,000 people enrolled in what's called the adult expansion group. So just a little bit more going back in history, because I've been working on this when Medicaid expansion started. I will say that I thought back and thought, well, when was the first time you worked on Medicaid expansion? It goes back to 2005, when under Missouri's Governor Blunt, reduced Medicaid by 10%. It was a pretty draconian cut. So we started there with a quite large budget cut to Medicaid, cut mostly adults on Medicaid, and 10% of the funding and 10% of the people. In 2008, with the election of President Obama, also in the state, Governor Nixon got elected, the last Democratic governor we had. He ran on reversing those 2005 cuts, and he also ran on a platform of basically implementing something like the Massachusetts plan, which mimicked sort of Obamacare. But although he tried to pass it 3-4 times while he was in office, he sort of backed off because, of course, nationwide we immediately turned to the debate over the Affordable Care Act, which passed in 2010. In 2010, the Supreme Court upheld the Affordable Care Act, but made Medicaid expansion voluntary, and that's really important because in the original Affordable Care Act, Medicaid expansion would have been mandatory. I want to point out that Missouri's, I didn't mean to do that. Missouri's unique in that we're a state that actually is voted twice before the passage of Medicaid expansion against the Affordable Care Act, once in 2010 and once in 2012. Once against the individual mandate by a very huge margin, 71 to 29%. And then in 2012, 62% to 38% against the state-based exchange. So I like to point this out because we're sort of an enigma in a lot of ways, because although we did eventually pass expansion in 2020, we voted against the Affordable Care Act, a few of the specific provisions of the Affordable Care Act twice in statewide referenda. So it's a very confusing sort of situation politically. In 2014, as you probably know, the Affordable Care Act opened, and almost immediately about half the country expanded Medicaid. And then by 2016, another 7 states or so had expanded Medicaid. And then it became harder for other states to expand Medicaid. And by the time Missouri expanded Medicaid, they were the 39th state to expand Medicaid. The last 5 of those were done by ballot initiative, going around the legislature and asking the voters to do it because the legislature refused to do it. Because as this last set of bullets points out, Governor Nixon had proposed expansion through the legislature several times, but the legislature refused to do it. So here's what the expansion looked like in 2020 that went to the voters. And it was actually fairly simple, very kind of clean expansion. It basically said that by March of 2021, the state had to pass a state plan amendment, and by July of 2021, the expansion had to begin, basically. And it was put in, importantly, and I can't emphasize this enough, it was put in the Constitution. It was not, it didn't say you would need to pass a law. It was put in the Constitution, which was done on purpose to mean that the legislature couldn't get around it because it was a constitutional provision. The other important provision, which may seem like inside baseball, but it's relatively important, it said there was no imposition of additional burdens or restrictions on eligibility. That basically means they had to give the people in expansion the same benefit package, and they couldn't impose things like work requirements. In Missouri, basically, we had started off, if you look at that bottom slide, we had started off in a state where basically parents who are not children or not pregnant women or not people with disability had a very low eligibility level of 21% of poverty, among the lowest in the country. So moving up to expansion, which was 138% of poverty, which you can see what that level was in 2021, about 18,000 for an individual, 30,000 for a family of 3, was a very significant increase. And as you can see, basically, if you didn't have children, you were not eligible for Medicaid. So the most important thing is that Medicaid expansion expands coverage to people without children, to married couples, and to a lot of people below the poverty line who are not eligible. The other important thing is expansion was paid for 90% by the federal government and 10% by the state, whereas normally Medicaid is the state pays 35% and the federal government pays 65%. So this means that the expansion is a lot more paid by the federal government, which is important from an economic or fiscal point of view. So the expansion passed 53 to 47, as I mentioned, and Missouri was the 39th state to pass expansion. After Missouri's passed expansion, North Carolina became the 40th state. There's actually a couple of those orange states left, the remaining 10, that are considering it now, even Mississippi that I read. we may see a few more. Some people say this margin in Missouri was pretty narrow. Although Missouri, as you may know, has basically become a red state, where President Trump won by 17 points. So having the Medicaid expansion win by a 6-point margin is a pretty big margin, probably. I think that sort of repeats. The main thing I wanted to point out here is when you look at where the expansion passed, it was mostly in the urban areas in Missouri. And this map in particular, which I snapshotted out of the St. Louis Post-Dispatch, got a lot of attention because they basically said most of the state is orange that voted against Medicaid expansion, and only in a few counties did they support Medicaid expansion. That was used to attack Medicaid expansion afterwards. So, and this slide points that out. Medicaid expansion passed in 8 counties: St. Louis County, St. Louis City, Jackson County, where Kansas City is. And so a lot of people pointed out, well, mostly passed in the cities, but a few of these surprised me a bit, such as Greene County, where Springfield is, and St. Charles actually voted in favor of Medicaid expansion, which is not a liberal bastion, and so on. So why did Medicaid expansion pass? And part of the reason I want to talk about this is because others, we have another budding ballot referenda possibly going on right now, or we do have one going on right now around the abortion issue. And it might be interesting to think about why the Medicaid expansion passed and see if there's any lessons learned. There was a huge fundraising advantage for the expansion side. It was basically about $10 million raised in the expansion side. The non-expansion side basically didn't raise any money at all. They basically waved a white flag. It was a well-organized effort, guided by previous efforts in other states. There was, as I mentioned, very little organized opposition until the very end. It had many prominent supporters, from the healthcare systems to the universities to obviously the advocates. And I think the impact of COVID mattered a bit because we were one of the first to actually expand Medicaid into during COVID. So as I will skip this because I think I sort of covered it, the state tried to stop the expansion, and the legislature tried to stop expansion, but the Supreme Court in Missouri unanimously said you got to pass expansion because it's in the Constitution. That's why I pointed out, importantly, it was in the Constitution. So kind of where are we now? Just jumping ahead. Here's a graph of the expansion enrollment, and with my grant that I work with the Missouri Foundation for Health, I keep track of this. And this is an enrollment chart that shows the number of people in the expansion population. You can see we started slowly. By the end of 2021, we had about 50,000. We had 100,000 in April 2022 and 200,000 in July. 1 year in, we had 270,000, which is pretty close to the number that I projected, and so did the governor, about how many we would have in the expansion. And then we hit 354,000 in June. And then we've been sliding downward since because of the unwinding, which I'll talk about in the next few slides. So, some people, it's interesting, I go around, some people said, have we started expansion yet? And I go, yeah, we got 300,000 people. It's a lot of people in the state. So this doesn't get as much attention as I think it probably does, because it probably deserves, because 300,000 people is a lot of people in the expansion population. But now let's talk about the unwinding. And as I mentioned, what happened in the during the pandemic was, if we think back to the COVID times, back in January of 2020, basically the pandemic hit very hard and people were enrolling in Medicaid. And when they were enrolled on Medicaid, the federal government decided that if you went on to Medicaid, the states could not disenroll you, even if you, say, lost your job or for some other reason you needed Medicaid. And that rule stayed in place during the whole public health emergency until June of 2023, and a very long period of time. And during that time, Medicaid enrollment rose nationwide from 70 million to 90 million, and it rose by 600,000 in Missouri. So what then started nationwide is what's called the Unwinding, which states were allowed by a law that was passed in Congress at the end of 2022 that said you can start disenrolling people or doing what's called re-verifications, annual re-verifications. And every state has done this a little differently, but what you can see on your slide is how Missouri's decided to do it. Basically, they've taken the 1.45 million people that were on Medicaid at the start, and they've split it into 12s, one 1/12 over the year, and every month looked at people on Medicaid and decided whether they should remain on Medicaid, and they determined whether they could be renewed or they were now ineligible. And what's on the graph, and this is a dashboard that the state runs, but we help them put it together. The blue bars are those that were renewed, either ex parte, which basically means automatically by looking at other records the state has. Renewed blue, light blue is you submitted a form to prove you're still eligible. And then the orange parts of the bar, you were determined to be ineligible. That was probably because your income was too high or you moved out of the state or some other reason. The darker orange has gotten a lot of attention. It's called closed for procedural reason. For some reason, something went awry in the process and the case was closed and the person lost their coverage. And I'll get back to that in a minute. And then the gray bar is they still haven't determined. And as you can see, there's a pretty large number that they still haven't even determined. Another way to view this is I've gone into these numbers and I've compiled them for the first 8 months. And so far, we've reviewed almost 900,000 cases. Of those, 60% have kept their coverage. 25% have lost coverage, about 221,000, 222,000 in Missouri. And 15% are still pending as of January. Among those losing coverage, that 25%, that red piece of the pie up above, 22% lost it because they reviewed the case and they said they were no longer eligible. And 78% were reviewed for what's called the procedural determinations. A lot of those we think were people that never returned their forms, that lost in the shuffle, something like that. When you look at actually the types of people that have lost coverage, I will give the state credit. We are reporting this. Not every state is reporting the categories of coverage. So if you look on the bottom of this graph, you got the expansion group, you have children, you have parents, the elderly or aged, persons, it's supposed to say persons with disabilities, and pregnant women. So those are sort of the main categorical groups that have historically been in Medicaid. And you can see how what's happened to these groups. And let me just cut to the numbers that I've accumulated by looking at all 8 months and by looking at these bars and the spreadsheets for the tableau that I just showed you. And you can see of the over the 8 months, about half, 47% of those that have lost coverage are children, about 105,000. 77,000 are in the expansion group and so on. Of those that are still pending, in other words, the state is still not determined what to do with them, it's a higher proportion of kids, 77,000, and that's 58%. We've actually, I get on regular phone calls with the state, and others are on those calls, advocates and people work on these cases regularly. There's a lot of attention paid to why are these cases pending. I think the state is doing double checking on these cases, and it's a reason why there's a lot of children in this group. So they may have determined, for example, their parents are no longer eligible, but they're trying to determine whether the kids are still eligible or not. This is a slide where I did a snapshot from the Kaiser Foundation has been keeping track of this on a regular basis. They have a website called the Tracker where you can look at all these numbers at a national level. And if you look, you can see the fourth bar from the left is Missouri. Nationwide, about 4 and 10, about 38% of the enrollments, disenrollments are children. Yeah, so 38% are children nationwide, but in Missouri, we're at 47%, which is among the highest in the country of those reporting. I will emphasize that not every state is reporting these numbers, but unfortunately, we're at towards the high end of this. Some states at the right-hand side, say California, Washington, Massachusetts, are not as high. So that's been a big concern among the advocates who've raised a lot of questions about this. Another switching to gears a bit is the people who are applying for Medicaid. And this graph is a little complicated, but let me walk it through it. The blue bars here are the numbers of people that are applying each month, and the orange bars are the numbers of applications that are pending, in other words, that they haven't processed. And basically what you see, maybe I can, I'll get a little pen here to show you. So at this early stage here, the number of applications were not that high. They were in the, 8,000 range. But then since then, we've been getting 17,000, 18,000 applications per month. Then during this period, in November to January of 2022, and also November to January of 2022 to 2023, and also the latest period, those are open enrollment periods when people sign up for Obamacare. So the number of applications jumps to closer to 30 or 40,000. And you can see what happened in the first time that the open enrollment period happened, the number of pending applications rose to close to 73,000, which caused a lot of media and other attention because the state clearly couldn't process these applications on a timely basis. Eventually what happened was CMS at the federal level stepped in and ordered the state to have a mitigation plan to clean that up. And you can see it worked because by the end of, by summer of 2022, the number of pending applications was down to a very reasonable number of 3,000 to 6,000 or so for most of several months. Even though they still got they were still getting a regular number of applications that was pretty steady. I've heard from the state folks that we are getting 500 to 700 applications a day. for Medicaid expansion, which is remarkable, even after all these months. But notice what's happened towards the end of this period, and it's causing us to get concerned, whereas there were 4,000 pending applications in July, there are now 53,000 as of January 2024. So we're getting into a period now again where there's a lot of pending applications as the new open enrollment period happened. I think in part this is because the state is also doing unwinding at the same time, and the state also is understaffed. So, and I noted, as you saw on the earlier graph back here, there's a lot of pending applications for the unwinding. So you got pending applications, then you have new applications coming in for Medicaid expansion. So some people have described it sort of as a perfect storm. So when a person applies for Medicaid, how long does it take the application to get processed? This graph is something that I accumulate and report, look at the administrative data and put a graph every month. And you can see it rose to a quite high number of almost 120 days in May of 2022. And then slipped down to 8 or 10 days for a good portion of 2023. And it's now risen up to 50 days. Just so you know, the federal rule on this is you're supposed to process these applications in 45 days. So having 50 days to process applications is, above the federal law. And I will point out that this is average days, which is basically a mean, just to sort of, think about it statistically, as we would encourage you to do if you're in our program. This is a mean, which means, if the mean is 50, that implies that there'll be quite a few people above 50, there'll be quite a few people below 50. And if the number's skewing, it'll mean that there would be people that have quite a large number of days. And we've heard that there are people waiting 80, 90 days to get their applications processed, which is, 3 months, which is probably, just really not acceptable. So again, this is what the Medicaid expansion enrollment looks like. I guess I repeated that graph. If you want to look at the overall enrollment in Medicaid, overall, it looks kind of like a roller coaster. When you put all this together, if you put the Medicaid expansion together with the unwinding, let me sort of walk you through this graph. Prior to the the pandemic, we peaked at about 1 million people in Medicaid. Then there was a slow drop in the number of people until the pandemic hit in early 2020. Then, as I said, during a public health emergency, which was declared early in 2020, federal government said you cannot disenroll people. So you can see what happened was a steady growth in Medicaid enrollment over time. And then Medicaid expansion started in 2021 around October because of the lawsuit. And then the number just picked up a little bit more. And then we peaked at 1.5 million. And then now we're seeing the unwinding, and we've dropped to 1.4 million roughly in Medicaid. So when you put all those numbers together, we peaked at the beginning of the unwinding at about 1.5 million. We've lost about 139,000 people in the Medicaid enrollment. As I told you earlier, sorry, there's a lot of numbers flying around here, but the unwinding, we lost 222,000 people that lost their coverage. The net drop is smaller than that, 139,000. You may say, why are those numbers different? Well, it's because some people continue to enroll in Medicaid because there's overall growth that happens over time. Some people may be losing their coverage and coming back. It's called churning. And And the Medicaid expansion is continuing. As I mentioned, the state says there still seems to be 500 to 700 people every month that are applying for the Medicaid expansion, which has surprised them. But it actually doesn't surprise me that much, because in the outstate areas, I think people still don't realize that they're eligible for Medicaid expansion. So the other thing that's going on in part with the unwinding is what's often called Obamacare. I think that's sort of the wrong term, because Obamacare, is really the whole law that was passed in 2014. But nevertheless, the marketplaces piece of Obamacare is the so-called marketplaces where you can go and buy coverage, private coverage. If you don't have employer coverage, if you don't have Medicaid, if you're above 138% of poverty, and you can get significant subsidies. That has hit, we haven't gotten a final number yet, but these are close to final numbers. In 2024, that has hit a record of 21 million. So far, it'll settle down to some number close to that. There are new people of 5 million that signed up this year. I think, that's an increase of 30%. I think a good portion of that we'll find out are people that might have lost their Medicaid coverage and signed up for a marketplace. In Missouri, 359,000 people are in the marketplace. So these are not Medicaid. These are people above 138% of poverty. That's a 40% increase over last year. So again, I think what's possibly happening is people that, as I mentioned earlier, 222,000 people lost their coverage on Medicaid. It's maybe not a surprise that we're seeing a pretty big increase in this number. I have this as conclusions here, but I have if we still have time, I think we do, Sarah, right? These are sort of preliminary conclusions. Let me go to a couple other things I want to talk before I actually draw conclusions. I want to talk about a little bit of preliminary numbers we have on the impact of the expansion. And I will say that before the expansion happened, our center, which is the Center for Advancing Health Services Research and Economic Policy Research, produced a bunch of policy briefs where we looked at the potential impact of the Medicaid expansion, but this was all forecasting and not actually based on what's actually happening in expansion. We wrote about 10 policy briefs, and they look sort of like this. And you can find them on our website, which will be in a link at the end of this presentation. But one of the things I wanted to show you in the last few minutes that we have here is to think about one aspect of what's been going on and show you some preliminary data we have, and look at hospital encounters and think about access and affordability and how Medicaid expansion might impact that. And I'm going to start with sort of a conceptual diagram here, but it's going to look a lot like that enrollment diagram I showed you earlier. And, as I think through this as a researcher and as somebody who wants to look at data, what we really have here is 4 periods when we're looking at something like hospital encounters, which I'm going to show you in a minute, the emergency room numbers in particular in the whole state. And we have data on that. So when you think about how Medicaid expansion has influenced that, think about the 4 periods that, I've walked you through up to this point in this presentation. Before expansion, during the pandemic, but, before the Medicaid expansion, and then the actual Medicaid expansion in Missouri, and now the unwinding period. So one of the things I think is interesting from a researcher's point of view is, if you think about it, Missouri is one of only 3 states in the country that expanded Medicaid in the middle of the pandemic. So we sort of have two expansions going on here. We got the pandemic expansion and we have the Medicaid expansion, the actual expansion of eligibility, and figuring out what's going on there is proven to be an interesting challenge. The other two states are Oklahoma and Nebraska, by the way. But almost every other state started their expansion before the beginning of the pandemic. So just keep this diagram in mind as we go through this data. There's a lot of words on this slide, but you know, basically what we're going to look at is the impact on hospital encounters, in particular emergency encounters and inpatient encounters. And the point is that if those encounters, what I'm going to primarily show you is the impact of the payer mix, the source of payment for those encounters. And when a person goes into, say, the emergency room, the source of payment is either private, Medicaid, there's a little typo there, should say Medicaid, Medicare, or uncompensated care. If there's a reduction in the number of uninsured due to the Medicaid expansion, for the healthcare system, this will mean less uncompensated care, which will prove what will reduce the burden on them, but it'll also reduce the burden for uninsured Missourians because they'll pay less out of pocket. So that's the sort of point of all this. So let me show you, without so many words, the emergency room department encounters. And so what we have here is an analysis of all the hospitals in Missouri from 2018 to 2023, mid-2023. And to simplify this graph, I'm not showing you payment by Medicare, by private payers, because actually those lines are pretty flat. But what I'm showing you is the proportion of emergency visits that are paid for by Medicaid, the green line, and the proportion of emergency visits paid for by the red line. And I'm sorry, there were uninsured or uncompensated care, that's the red line. And what you can see, hopefully, is that prior to expansion, the uninsured or uncompensated care was somewhere between 25 and 30% of the emergency visits, and Medicaid was about 20%. And those, by the way, line up pretty well with the enrollment numbers I show you. But after the public health emergency begins, what you see is the Medicaid numbers, the Medicaid line slowly increasing, the uninsured line slowly dropping, and that picked up after the expansion, so that by the end of the expansion, you see that, you know, the Medicaid line is close to 35%, and the uninsured line is close to 10%. This chart here may show you breaking those numbers down, and it shows you the Medicare and other numbers, but down at the bottom, I might want to highlight a few numbers for you. As you can see, the Medicaid percentage during the PHE, public health emergency, rose by 3%, and then it rose by 14% during the expansion, and now it's dropped in just the first couple months. We need more data. We're about ready to get it. 1% during the unwinding. And then if you look over at this last column over here, during the expansion, the uninsured or uncompensated care dropped by 11%, and as you would probably expect. So what this means basically, I think, is, you know, maybe fairly obviously, is that the dollars going to the hospitals has shifted quite a bit. They're getting more from Medicaid and less that's uncompensated care. But it also means that the uninsured are being asked to pay less which is obviously the whole point of Medicaid expansion. This is, in case you're curious, we have a lot of other graphs and data that we're looking at. Sorry, I think the colors here didn't transfer quite right when I did the switch to this template, but the Medicaid is the top line and the uninsured is the bottom line. So this is inpatient counters. It's not quite as dramatic. It's pretty flat until the Medicaid expansion begins, but nevertheless, you can see that Medicaid was up 10% and the uninsured down 9% since the PHE started, which is pretty much the same pattern. And the last sort of thing I'll show you is how this varies by region in the state. And this is data through 2022. We're waiting to get more data by region. And if you're not familiar with what are called the Burfus regions in Missouri, Missouri's broken out in the way on the left over there with St. Louis area being yellow and Kansas City red and so on. One of the things you'll see here is that the increase in Medicaid in Kansas City was pretty high. The drop in uncompensated care was, 15%. So Medicaid rose by 16% and uncompensated care dropped by 15%. And so on St. Louis area, again, Medicaid rose by 15%, uncompensated care dropped by 12%. So there's not a huge amount of variation by region, but there is some. So I'm going to wrap up here and tell you that there are resources we have on our website where you can learn more about all this. We run a Medicaid dashboard that we update monthly on our website. Our center has a website which is also the second line there, which has a lot of the policy briefs I talked about and presentations and papers, which you can see. And there's a whole lot of other resources that are available on our Center for Advancing Health Services Policy and Economics Resources. So that's it. And I guess I can stop sharing. Does that make sense?
Yeah, I think that works. Thanks so much, Tim. We do have a few questions in the chat, and we do have still a few minutes to go through questions. So if you have questions, now is a wonderful time to post those in the chat. But I'll read the first one. What were the possible factors that led to the drastic drop in 2020? And what was done differently to gain such a boost in the expansion?
I'm trying to understand the question. What were the possible factors that led to the drastic drop in enrollment? I guess that might mean in 2020.
That's what I'm assuming, enrollment. Yeah.
So if that's what the question was about, and whoever wrote this question can add elaboration on that if they want. So coming into expansion before 2020, and I was chair of the Medicaid Oversight Committee at that point. We did a lot of what we're doing now, which is called reauthorization or redetermination and re-verification, and they looked at every person's record and determined whether they were still eligible for Medicaid. And in that period, which also took about a year, the state lost Medicaid. About 130,000 people lost their Medicaid coverage, and about 100,000 of those were children. So that was right up until pretty much the start of the pandemic. And the reasons for why that happened were complicated. as chair of the Medicaid Oversight Committee, I was complaining quite a bit about that because I didn't understand why children were losing coverage. And frankly, right now, I think we're still complaining about why children are losing coverage. But because children are eligible up to 300% of poverty line. So it's a open question as to why that is. And it appears to be the case that the reason children lose coverage is they get kind of lost in the shuffle of those procedural reasons. They don't, their parents don't answer the forms. There's a lot of address changes that happen. Sometimes the forms the state sends out are not in very accessible language. Some people in Medicaid, English is not their first language. And sometimes people would get a form that said you need to redetermine that you're on Medicaid, and they think it's a form that says they're still on Medicaid and they throw it away. And so on and so on. So there's probably a host of reasons. Also, it's kind of well known that we have the worst call center in the country. We have some of the worst numbers in the country. And what I mean by that is we have a call center where you can ask to get help if you need help. And the delays on that call center are on average about 47 minutes, which is ridiculous. And if you're a low income person, maybe with minimum wage jobs, you can't just kind of like sit there for 47 minutes waiting for an answer about why your Medicaid coverage is not being processed on time. Some of that got fixed, although obviously some of it's not getting fixed because we still have a lot of pending children.
Thank you. The next question, is self-pay considered private or uncompensated?
So the self-pay in the way the data, and sorry, I went over that fairly quickly because it's a long presentation with a lot of stuff going on. And if I had concentrated just on that, I would have been more clear about that. So I apologize. The way we would break out the data is the private is private insurance. And the self-pay would be uncompensated. And so that's basically uninsured or self-pay. So it's a great question.
Do you have data on the current numbers of uninsured persons in Missouri and what is thought to be the biggest factor contributing to that?
That's a great question. We're dying to get those numbers. We don't have data yet. And here's just sort of a 1 minute answer on that. Where we get the number of uninsured is we get it from census surveys or federal government surveys, and they're done about once a year. And the federal government, the main source of that is what's called the American Community Survey. And it's put in the field in March of every year. So it's about ready, probably going, this is March, so it's going in right now for 2024. And we will not get that data so we can look at it, and it's not reported to us until like August. So we won't know what that looks like until August. We have the data from last year. And it didn't show much change in Missouri, and it showed some change. And frankly, I'm sorry, I don't remember it off the top of my head, but it showed a little bit of a change. But unfortunately, the numbers from last year were just kind of at the beginning of the expansion, and so it didn't show much dramatic change. So I think we're really looking for this year's numbers to see what's going on. The one thing I will tell you about the uninsured overall, and I've been studying them for 30 years in my career, is nationwide we're at an historic level of the uninsured, historically low level. Going into the Affordable Care Act, we had about 16% of the country that were uninsured, 1 out of 6. And these are non-elderly, obviously almost all elderly people are on Medicare. So 1 out of 6 people were without health insurance, and in the latest numbers nationwide, about 7% of people are uninsured, which speaks to the success of the Affordable Care Act in reducing that number. I believe the number in Missouri is closer to 10%. I'm just doing that off the top of my head. I think when we get the full effect of the Affordable Care Act, and it'll probably be, I would guess 8 or 9% in Missouri, a little bit above the national average.
Thank you. A couple more questions. What does the process for reapplication look like now that continuous enrollment is not in place? And has Missouri done any outreach to get folks to reapply?
So reapplication is a great question, so if people lose their coverage through the unwinding, as it's called, then, people may not even realize they lost their coverage. What might happen is they may actually, go into the doctor and hand them their card and they'll say, you're not covered. And then they'll have to reapply. So, basically, we've been told that if it happens within 90 days, they can be put on the rolls pretty quickly. And basically, it sounds, almost, you can call a call center, but of course, I told you about how difficult it is, but there is an online application form, which actually I think works quite well. Back about 5-6 years ago, they didn't have an online application form, believe it or not, but now it works pretty well. So basically people can fill out an online application form, and I will give the state a lot of credit due to the efforts of some of the people in Medicaid. When Todd Richardson took over as director of Medicaid and some of his deputies, one of the first things they noticed was the application form for Medicaid was 60 pages long. 60, and he brought in somebody who was a business person in healthcare, and he said, this is ridiculous, and they got it down to 16 pages. So that's, everybody was applauding that, and it probably shouldn't even be 16 pages, but that's really progress.
Better than 60.
Yeah, so
Wow. Let's see. This is the last question we have on here. The substitution of Medicaid for uncompensated would appear to be a boon for hospitals. Politically, have the providers been fighting to keep coverage during the unwinding?
No, that's a great question. This is a complex question, as you can imagine. They've been monitoring these numbers quietly, and these data that we get from the hospitals is their data in a way. And they're obviously very happy about the impact of the Medicaid expansion reducing their uncompensated care, which helps their bottom line. And they've been very nervous about the unwinding, although I don't think they see it at an individual hospital level, but they haven't seen it sort of statewide. And frankly, when we put out our numbers, we're one of the few people that are putting out these numbers statewide. I will tell you that they're nervous. I think it's the nature. Let me just put it this way: it's the nature of a hospital CEO, it seems, to be nervous, even when in the face of good news or bad news. Seems like they're always nervous. So like when the Medicaid expansion was really helping them, I was saying, you must be very happy. But it seemed like they were worried that what the state give us with one hand, they're going to take away with the other hand. So what they were worried about is the state, obviously the government, the legislature lost what they wanted on the expansion. So what they're trying to do, I was told, was to squeeze down on payment. They think that the hospitals are overpaid. This belief has been out there for a long period of time. And if they believe that the expansion is helping hospitals, what they're going to do is squeeze their payment at the other end, saying, well, now you've gotten a big boon from expansion, so now we're going to lower your reimbursement for hospitals. And that's what they're worried about, actually. And I don't know, I just sort of state that worry just to put it out there, because I don't know if it's real or if it's not real, but because I think there's probably some legitimate reason to be worried about that.
Great. Well, thank you so much, Tim. I'll turn it over to Sarah Sims to close this out.
Great. Thank you so much, Sarah and Dr. McBride, for the presentation today. Just a quick reminder that we do record our open classroom programs. You can find them at the webpage listed on your screen, QR code on your screen, or the webpage in the chat. We have over 200 past open classroom programs that have been recorded and shared there. So we invite you to check those out and share with colleagues. And then finally, I want to invite everybody to our next open classroom, which is next week on March 12th. That's with Dr. Megan Keys, who will be presenting on the mental health implications of abortion restrictions. So we hope to see you next week and for an upcoming open classroom. Thanks, everybody. Bye.